this is the review of the 2023 A paper, which was just done on Tuesday. And one of the key objectives that I want to go through with you today is show you which ones are the repeat, which ones are the new questions, and also which ones are variations of questions that have been asked before. In other words, that they've sort of rephrased it, and you can sort of get like a similar idea in terms of what concepts that the examiner is asking for. Now, I've got a level of difficulty, which is a traffic light system. So how I sort of group questions are green, yellow, and red. And green represents a question with a repeat, with a pass rate of more than 40%. And what I've done is I've contextualized it to say that it has to be within the last 10 years. Because I think for most of us, when we do our revision, we are looking at short answer questions from the last 10 years, okay? And I think that is important for us to define that timeline, because as time goes on, the number of questions that you'll see in the bank increases. And, you know, for you guys that are sitting later and later on, there's going to be an increased bank of questions, but your time is always going to be limited. So that's one of the key things that you need to understand, is that you're not going to have an infinite amount of time to cover everything. So most of the recommendations will sort of say do the questions from the last 10 years, but I'll also show you why it might be advisable to go beyond 10 years as well. All right. Now, the yellow card is for any questions that I think that are variations of an older question or a repeat with a pass rate between 20 to 40%, or a repeat that was over 10 years ago. Because if it's a repeat that's over 10 years ago, chances are that you may not have actually seen it before. All right. And then the red ones are new questions or a repeat with a pass rate less than 20%. Now, with each of the questions, I'll also go through with you the learning objective or objectives that are associated with that short answer question. Now, the first question on this paper was list the potential adverse effects of opioids, briefly outline the mechanisms of each adverse effect. And now I've coded this as green. It is a repeat question, but I say it with a caveat to say that it's just been rephrased slightly, okay? So the repeat was in 2012 B4 with a pass rate of 55%, and 2005 A2 73%. So it's certainly within the last 10 years. And the way that it was phrased previously was outline the acute adverse effects of opioid receptor agonists, describe the mechanism of the acute adverse effects of opioid receptor agonists. So what we have here is a question which is essentially the same as the one that was asked in 2012 before, but rephrased slightly differently. So in other words, that now we're asking you to list as opposed to outline, which is sort of a similar idea here. And then after that, the second part is briefly outline the mechanisms, which also in the repeat has also asked you to do in terms of describe the mechanisms there. All right. So I think this is a fairly sort of straightforward question to start off with. The learning objective, which this is tied to, is PTPM 1.19, describe the adverse effects of opioids administered by systemic and neuroaxial routes and their prevention and management. So certainly if you cover that objective, you would be covering this short answer question here. And I think that's a fairly sort of straightforward one to start off with. So no surprises on this one here. And then the second question is discuss the advantages and disadvantages of using nitrous oxide as part of a general anesthetic. Again, coded green. And this was a repeat, again, within the last 10 years from 2017 A5 with a pass rate of 81%. Fairly straightforward one. Learning objective is BTGS 1.28, describe the comparative pharmacology of nitrous oxide. And then the secondary objective would also be BTGS 1.27, which is describe the pharmacology of nitrous oxide. When you have this question in terms of advantages and disadvantages, you don't just talk about the pharmacology of nitrous oxide. Whenever you list one of the components there, you need to make sure that you think about it in terms of how is it different from, let's say, sevoflurane, and how is it different from intravenous anesthetics. That's going to take a little bit of skill and a little bit of thought to do it sort of beforehand, because you certainly don't want to be, I guess, haphazarding comparing it to sort of both. You sort of want it to be sort of structured and understand where is it important for me to comparing it with an inhalational agent, and where is it important for me to compare it against an intravenous agent, because you can see that there are actually, a number of routes where you can take this down into. All right. I would think for the most part, for the core of this question would be comparing it to an inhalational agent. Okay. Because certainly a lot of the advantages of TIVA would be in terms of, versus volatile agents itself, primarily the one in terms of nausea and vomiting. Okay. So for me, for this question here, will be primarily based to compare it against another similar inhalational agent. But I think that you can also include some of the intravenous agents there, but that would be a very small component. Now, question 3, briefly outline the principles of antibiotic prophylaxis for surgical site infections using cafazolin in knee joint replacement surgery as an example. Again, coded green, asked in 2019, A13, with a pass rate of 60%. And the learning objective is BTP of 1.1131. Explain the principles of antibiotic prophylaxis. I think that's 1.131. Apologies. And again, I think this is a sort of fairly straightforward question. No surprises there, especially if you've done the repeats from the last 10 years. Okay, this is one of the harder questions that I think a lot of people struggle with. This was question 4 and separated into 3 components. Question A was briefly outline how body tissue composition is progressively altered by morbid obesity. Question B, define each of the following terms: total body weight, ideal body weight, adjusted body weight, and lean body mass. And then the third one is briefly comment on the suitability of each of the above terms when used as a scalar for estimating an induction dose of propofol in a morbidly obese patient. Now, I think when you look at this question here, the complexity, I would think, would lie in B. B would actually worry me a bit, okay? Because B asks for actual definitions and formulas for each one. Now, commonly, total body weight, easy. Ideal body weight, I think, is fairly sort of straightforward. Lean body mass is via the James's formula. That's a little bit complex. I never thought you had to learn it. But it looks like if you wanted to have a perfect mark here, you would need to know the James's formula. I mean, I certainly just know it as a James's formula, but if you do want to know it, it's that, 1.1 times total body weight minus 128 times total body weight divided by height squared. And that's for a male. And then for a female, instead of 1.1, it's 1.07. And instead of 1.28, 1.48. So very tricky numbers to sort of learn there. Now, the one that really sort of got me was adjusted body weight. I have seen it before, but I haven't seen it in a recommended text. All right. Now, I do know where this question came from. Do you guys know where this question came from? Any idea? This question has come from the book by Lockley Rathie, the ANZCA companion textbook. All right. This is the only book that I've seen, as in the ANZCA textbook, where adjusted body weight has actually been in there. Otherwise, I haven't seen adjusted body weight before. So just be aware. Adjusted body weight, the formula for adjusted body weight is your ideal body weight plus 0.4 in brackets, your actual weight or total body weight minus your ideal body weight. Okay, so it's a little bit tricky, this one. I would think that this question here, where I think that it would have tripped a lot of people up would be that second one. And I tell you why. When you have a question like this and you know that there's a term that you're not familiar with, it really plays on your mind. I think that if you take out section B and you just think about it in terms of, you just think about it in terms of A and C, I think most of you would be able to get through this question okay. I think where the real difficulty lies in is when you sort of see this B part and you go, how am I going to answer this question? And it really plays on your mind as you try to answer this question. It would have been rare for someone to actually memorize the formula that's required for these, especially for lean body mass. Ideal body weight, the formula is okay. Ideal body weight is that, 50 plus 0.9 kilo per centimeter above 152 and 45 and a half for females. That one's okay. Total body weight's quite easy, but yeah, adjusted body weight and lean body mass, I think would have been challenging. It is an interesting question, but yeah, definitely I would say one of the more difficult ones in this paper here. So, that's why I've called it this one red. All right. So it is a new question. It is related to the 2009 B4 question, not completely, which is describe the effect of obesity on pharmacokinetics and the potential clinical implications, providing relevant examples. I think if you had done that question previously, what you would find is you could probably answer, I would think, 30% of this question here. Okay. So there is some similarities there, but completely new question and probably a really challenging one for, I think, a lot of trainees. Now, the learning objective here is BTGS 1.33, which is describe how physiological and pathological disturbance can alter the pharmacology of intravenous anesthetic agents. All right. Question 5. Classify drugs which can be used to treat bronchospasm during a general anesthetic. For each, give examples and briefly outline the mechanism of action and side effects. So this is classified green. It is a repeat, but again, this is a rephrased repeat. So the original question, which was asked in 2014 A6 with a pass rate of 59%, 2008 A4, 79%, 2006 A1 with a 44% pass rate, is outline the pharmacological management of bronchoconstriction in acute severe asthma, include mechanism of action and potential adverse effects. So repeat a question, but just rephrased differently. And this will be a common theme throughout this new paper, all right, by this new chair of examiner, is that one of the things that I've sort of seen is that there are repeat questions, but they're rephrased. So be aware, that's something that's really new in this paper here. Now, the learning objective, the primary one is BTPO 1.40, which is describe the pharmacology of anti-asthma drugs, including beta-2 agonists, corticosteroids, anticholinergics, leukotriene antagonists, and theophylline. And I think those would be the ones that you would want to have in this answer here. Okay. Now, question 6, compare and contrast the pharmacology of vecuronium and cisatracurium. I've coded this one red. And the reason for that is that this is a new question. So that if you have a look at one that is similar in the past within sort of the last, not even the last 10 years, this was asked ages ago, but 2000 question B16, there was a very similar one that said compare and contrast the pharmacology of atracurium and cisatracurium. More recently, within the last 10 years, the muscle relaxant that was asked to be compared was rocuronium and succinylcholine. Okay, so this one here is compare and contrast the pharmacology of VAC and cis-attract. I think most trainees would head towards a table. Just be aware, I want you to have a look at my session on compare and contrast. One of the challenges with a table is that, remember that with a table, you're just writing information down, okay? You're not actually comparing, contrasting. So that's a really important thing that you need to understand, is that with a table, all you do is just, you're putting all the information down on VEC and you're putting all the information down on cis-attract. But where that compare and contrast occurs doesn't happen unless you put a third column in. And when you put that third column in, what you'll find with a table is that you're repeating information that you put in the column 1 and column 2. So there is a bit of a skill to doing compare and contrast questions. I'm trying to move away from tables because I think that, if, in terms of time efficiency, you end up just writing a lot of repeated concepts again. All right. So just be aware the real trick with doing compare and contrast questions. And I think you can certainly group it in terms of pharmaceutics, kinetics, dynamics. And my tip for these ones is always to think about them in terms of drug A and drug B. So that drug A, and you can choose whatever one you want, but drug A here will be vecuronium, and drug B is cis-atracurium. So in other words, what you would say for, let's say, pharmaceutics, you would go vecuronium is presented as a powder compared to cis-atracurium, which is presented as a clear colorless solution. See,
sure.
You see how that?
Yeah,
and that's actually a compare and contrast, because what you would do in a table, you would just say
you just
powder.
list them. Yeah,
correct. Yeah, and therefore you're actually comparing and contrasting the two. And remember that when we compare, we're saying things are similar. When we're contrasting, we're saying that things are different.
Yeah. No, that makes sense.
Yeah. All right. So tricky one. And I think compare and contrast questions are really one of the most challenging questions to do. And also advantages and disadvantages questions as well are also challenging as well. Okay. So look, the learning objectives for these ones, BTGS 1.36, describe the pharmacokinetics of neuromuscular blocking agents. 1.37, pharmacological differences between neuromuscular blocking agents and clinical importance of these differences. And 1.38, the adverse effects of neuromuscular blocking agents and factors that may modify responses to muscle relaxants. Okay, good stuff. Okay, question 7 is describe the structure and function of the NMDA receptor and briefly outline the interaction of ketamine with this receptor. So again, this is a fairly recent repeat in 2020, B10 with a 44% pass rate. And what I also did was I actually went through the ICU paper as well to see whether there was any questions lifted off from there. There was a very similar one in 2022, not verbatim, but very, very similar in terms of asking about the NMDA receptor and ketamine. And that was in 2022, A11 with a 74% pass rate. And the learning objective here, the primary one is BTPM 1.26, describe the location and role of NMDA receptors. And then the secondary one is BTPM 1.27, describe in detail the pharmacology of ketamine, including mode of action, clinical utility, metabolism, toxicity, advantages and disadvantages of different routes of administration. Question 8. I've labeled this as yellow because this is a variation of a question that has been asked before in the past. Okay, so draw and label a circle breathing system, define apparatus dead space, and describe the parts of the circuit which comprise of apparatus dead space, list the functions of the APL valve, justify the position of the APL valve relative to the other components. Now, the variation of this question was from 2016 A2 and 2015 A1. So 2016 A2 had an 89% pass rate. Draw and label a circle breathing system explain its advantages and disadvantages. And in 2015, A1 was describe the circle breathing system. So certainly if you've done those questions, I think you would have had a good template or approach to answering this question here. And the learning objective was primary BT SQ 1.13, describe and classify breathing systems used in anesthesia, evaluate their clinical utility and hazards associated with their use. What is different about this question is really B and C, the definition of apparatus dead space and which part of the circuit which comprise of apparatus dead space. This one here would be part of an MCQ question. All right, there was an MCQ question on this with a diagram which asks you to label which part of the circuit was the apparatus dead space. So this one's lifted off from an MCQ question. And I think what would have made this tricky would be question C, list the functions of the APL valve and justify the position of the APL valve relative to the other components. Hopefully, you know, when you went through the variations in 2016 or 2015, you would have sort of learnt about why the APL valve is where it is, okay, and how it can actually change, as in during the construction of the circle breathing system. There's actually a text in, I think, can't remember which of the equipment book, but they talk about where the APL valve is relative and what are the issues related to where the APL valve is in terms of the circle breathing system. All right. Okay, question 9. Briefly outline the principles of arterial blood pressure measurement using an automated oscillometric non-invasive monitor. Briefly outline the potential sources of error within this device. I've coded this as green. Again, another repeat within the last 10 years. So 2018 B1 with a 42% pass rate, 2003 A13 with an 81% pass rate, and 2000 B2 with a 70% pass rate. And repeating the theme of how they're just rephrasing old questions, but essentially you can answer it the same way. The ones that have been repeated have been written as briefly describe the principles and sources of error in the measurement of systemic arterial blood pressure using an automated oscillometric non-invasive monitor. What has become really apparent with this new paper is that they really want you to separate the two components out, and they want to make it obvious to trainees that there are actually two components to a question. So I'm seeing a lot of A, B, and C in this paper here. Previously, if you look at the old questions where they used to be like similar to this, principles and sources, now they're saying it in terms of we want you to answer A, which is the principles, and then B, sources of error. So that's a really sort of new thing that has come across, hopefully to your advantage, to make things a lot clearer in terms of what needs to be answered. All right. Now, the learning objective is BTSQ 1.6, describe the methods of measurement applicable to anesthesia, including clinical utility, complications, and sources of error, in particular, measurement of blood pressure. All right, question 10, describe how oxygen and carbon dioxide are carried in hemoglobin. New question, but there is some similarity to the 2019 B12 question, which had a 28% pass rate. So that question there was draw the oxygen hemoglobin and carbon dioxide hemoglobin dissociation curves on the same axis, partial pressure versus content, compare and contrast these two curves. I think that if you could probably apply 50% or more in terms of what you would have written in this 2019 question to this question that was asked on Tuesday. So I think there are a lot of concepts there that you could have applied, and, like the graph, some of the ideas in terms of the Bohr effect, Haldane effect. But, the concept is that now it's a little bit more detailed with this question in terms of how oxygen and carbon dioxide are carried by hemoglobin. All right. So that's one of the key differences there. I think with that 2019 question, there was probably a focus in terms of the numbers that you would need to reproduce on the actual graph or the curve. This one here is more about the description, okay, about how oxygen and carbon dioxide are carried by hemoglobin. And the learning objectives here are BTPO 1.31, discuss the carriage of oxygen in blood, the hemoglobin, the oxyhemoglobin dissociation curve, oxygen stores in the blood and their clinical significance and implications, and 1.32, which is discuss the carriage of carbon dioxide in blood, the CO2 dissociation curve, and their clinical significance and implications. All right, question 11, another difficult respiratory question and a new one. Describe the properties of surfactant and relate these to its role in influencing respiratory mechanics. So completely new one, but taken verbatim from a learning objective. This is the first time I've seen a short answer question taken verbatim from a learning objective. So do note, this is something that is new, okay? And the learning objective is BTPO 1.10, describe the properties of surfactant and relate these to its role in influencing respiratory mechanics, like word for word. And I think that is something that is really important moving forward, because it really puts the onus to make sure that you start almost treating learning objectives as short answer questions. Not all, but certainly I think some of the learning objectives that come up, you can probably treat them as, if you think that they're appropriate, as a short answer question. And if I was to ask you in terms of where would this question be related clinically or be clinically relevant to you, what would you say?
So in like premature infants, I think when surfactants produced, I think it's like 32 weeks or 28 weeks or something like that.
Yep.
So yeah, probably including that.
Correct. And in fact, that's probably the angle. If I got a question like this and I've never seen it before, that will be one of the angles that I would sort of try to take, is think about it. All right. So clinically, or where would this objective be important in my practice, and then try to apply or incorporate some of the ideas into this question here. And I think by doing that, you might be able to sort of cover quite broadly some of the issues related to why surfactant is important. And as you said, it's going to be really tied to the idea of compliance. Okay. But yes, know that surfactant also has immunological functions as well. And I think you'll sort of go through all that when you describe the properties of surfactant. Okay, but the big one is going to be its effect on surface tension. All right, question 12, compare and contrast the effects of general and neuroaxial anesthesia on thermoregulation. I've coded this green. It's a repeat from the last 10 years, 2015 A15, with a 41% pass rate. And the learning objective primary one is BTGS 1.68, describe the physiological reasons to lowered and raised environmental temperature and the effects of anesthesia on these responses. And then the secondary one is SSPA 1.23, define the thermoneutral zone, describe temperature regulation in the neonate and physiological responses to lowered and raised environmental temperature, the effects of anesthesia on these responses, and how these changes with growth and development. Now, SSPA 1.23 is actually is a pediatrics one. So this objective here is with in reference to the neonate. Certainly here, it doesn't actually specify that this is a neonate. This is probably for an adult, but you could probably add a component in with regards to the neonate to make this a really sort of complete answer here. All right. Good. Okay, so I think question 13, I know some of you might have found this a little bit tricky. Briefly outline the production, metabolism, and role of lactate. I've coded this yellow, all right? And the reason why it's yellow was that this is actually a repeat. It's actually a repeat, but it's a repeat from over 10 years ago. All right. So it was repeated 2011 B16 and 2009 A15, rephrased, but essentially the same question, which is describe the formation, fate, and role of lactate in energy production. In fact, this is the only repeat that I've seen here, which was over 10 years ago. So it is important to know that. And I think it just sort of help guide those who are studying for the ORGS exam how to strategically think about their study plan, which I'll sort of go through at the end. All right. So the learning objective, again, primary one is BTPO 1.82A, outline basic cellular physiology, in particular, the energy production by metabolic processes in cells. Okay, question 14. Draw and label a central venous pressure trace. Include on your diagram where ventricular systole and ventricular diastole occur. Explain the physiological basis for each component of the pressure waveform. New question. It is a new short answer question, but this is a question that's commonly asked in vivas. So this is one of the other new directions that I've noticed about this paper here, is that they are asking questions which I've seen in viva stems, and they're incorporating it into short answer questions. This is a fan favorite, a staple of viva questions. This is something that I normally work on for the viva. So it's it was a little bit of a surprise to see this, but this would be a really, as I said, a staple in terms of viva questioning to draw this pressure trace. So the good news is that it won't be asked again in your viva. But yes, that is certainly one of the key things again from coming up from this paper here. Okay, is that viva questions are now being incorporated into short answer questions. So again, new question. The learning objective is primary BTPO 1.45. Discuss the factors that determine and control cardiac output and the implications for clinical practice, including pressure-volume relationships in the heart. A very generalized objective that basically goes through all the different pressure-volume relationships. Okay. And then the question 15. So question 15 is describe the pain of the first and second stages of labor using the following headings: the causes and characteristics of the pain, the anatomy of the primary afferent nerves and spinal segments involved. This is a difficult one. It has been asked in the past, and the reason for this, for why it's red, is because the variation had a pass rate of less of 20%. Okay, so the variation was 2017 B1, described the visceral and somatic pain of labor with particular reference to the anatomy of the pain pathways. But, I think that if you had covered this question here, probably would have been able to answer, 50 to 75% of question 15. All right. And the learning objective, primary SSOB 1.8, describe the anatomy and physiology of pain in labor and childbirth. And so, look, this is my summary of the 2023 paper. There were 7 green questions. So what I thought were fairly sort of straightforward, 2 yellows and 6 reds. Now, of all the ones I've done over the last 2 years, 6 reds is the most that there's been. All right. So last year there was 4 reds. Last inning there was 4 reds, and then a year ago there was 5 reds. So 6 reds, certainly, I think, in terms of the optics of it, I guess a lot of trainees would have felt this is probably a more difficult exam. All right. You could say that it's counterbalanced against the 7 green. Again, I think, I think a lot of us would sort of focus on what's there in terms of the difficulty there. Okay. Now, topic-wise, very balanced in terms of the spread of topics. So pharmacology, 6.5. So opioids was asked, inhalational antibiotics, induction, which was applied, which is the morbid obesity question. They got respiratory pharmacology, muscle relaxants, and half a pain question. Half a pain question was the NMDA receptor and ketamine. Physiology was 6.5 topics, so 6.5 questions. So again, pain half. 2 respiratory questions, temperature, metabolism, cardiovascular, and obstetrics. And then 2 equipment questions, breathing systems, and a measurement question here. I think just looking at the topics that they've chosen, it's pretty standard to me. But I agree with you when you do a deep dive on the questions. I guess the reason why it's challenging is that some of the core topics, like respiratory, had very perhaps peripheral questions. Now, this is the other interesting thing that that your note has changed. Note how pharmacology was asked in order. So 1, 2, 3, 4, 5, 6, and then half a question in phys pharm, and then equipment was 8, 9, and then after that, physiology was 10 to 15. This is a change. So previously, if you look at the other papers, you would see that physiology and pharm were always random. You know, some pharm, some phys, some phys and pharm. This one here very structured in terms of pharm were the first questions here, equipment measurement middle, and then physiology last. Okay, and I've sort of ranked them in terms of the difficulty. So in terms of pharmacology, 2 hard ones, 4 straightforward ones, and then physiology, very, a lot more difficult. So four really difficult ones, 1 straightforward one, 1 intermediate one. Now, you can see the bias that's here because the hard questions really came towards the end, especially if you did them in order, you would have found that the exam would have been increasing in difficulty as you went along. Okay, and what obviously makes this really challenging is that if you do it in order and you have the hard ones at the end, that time pressure also compounds that difficulty. There were 5 new questions, 1 verbatim from the learning objective. There were 2 variation questions. The last print was 2016, 2017, and then 8 repeat questions. And one of the new things about the repeat questions is that they've been rephrased. So half of them were rephrased. 2011, 2012, 2014, 2018 were all rephrased repeats, but you could essentially use your same answer to those rephrased questions, and it would be the same. You would get the same concepts that would be required to be answered that question. The verbatim ones were 2015, 2017, 2019, and 2020. So in other words, these are my observations that have changed. And remember that there's been a new chair for the primary exam. So that's why you'll see this new change coming through. Certainly, I would say that this is probably one of the more difficult exams. And the bias for that is that there were 6 red questions compared to previously 5. Previously 4 in the last exam and 5 in the one last year. And there were 5 new questions. Previous to that, from memory, there were 4 new questions in the last paper, and I think there were only 4 in the one before. So, having that extra question and extra cognitive load certainly, I think, would have impacted in terms of the overall feel of the exam. It's amazing, isn't it? You sort of think about it. It's only 1 extra hard question. But trust me, 1 extra hard question really throws off the whole balance of the feel of the exam, because, that 1 extra hard question, and, I think a lot of us would agree that question 4 was probably the hardest, the morbid obesity one, would have thrown a lot of people out. All right. Now, I guess from the examiner's point of view, they would have said, look, despite there being 6 red questions, you're counterbalanced by what they would deem as 7 straightforward questions. Okay, and certainly 7 straightforward questions would be more than what you would have seen in the previous exams. So in previous exams, it was, I think, 6 or 5. So certainly more representation of straightforward questions. But I think if you ask the trainees themselves, there is never such thing as a straightforward question. All right. So even though I can say that it's a, that this is a green question, I think that, it's always challenging, to sort of say that it's counterbalanced against, that despite there being more red, there's also more green as well. All right. Now, the second observation is that the basic science questions now look to be ordered. So what I mean by that is now they're asking all the topics in terms of order. So pharmacology, equipment, and physiology, whereas previously it's been random. So it'd be interesting to see whether this is something that gets repeated again in the second half of the year. And you know what? I don't see why not. It makes sense to me. So that's something for you guys to also know that, when you study, think about perhaps, doing pharmacology, doing equipment questions, and then doing your physiology questions last when you set up your practice exam papers, okay? And the other thing that has also occurred is that they do repeats, but they're rephrasing them. Now, I guess that could be a good thing because some of the repeats that are there, if you think that there's some ambiguity associated with them or that there are sections associated with them, what they're doing now with the rephrase repeats is that they're ordering in terms of what is the concept that needs to be answered for A, what is the concept that needs to be answered for B. So really sort of, in fact, giving you a structure on how they want the question to be answered. The other observation is, for the first time, I've seen a verbatim learning objective being asked as a short answer question. Okay, that is really important for you guys to know. And I think that also means that, when you look at how to revise for this exam, start thinking about if you see a learning objective which says describe, perhaps it can actually be asked as a short answer question. And that would be something that, you can incorporate into your revision phase of the exam. All right. Now, the last bit is there were no questions that were asked from the recent ICU paper. So I know that there was one that was asked from 2022, which was last year, but certainly nothing was lifted off from the 2022B paper. Okay. Now, the other thing that I want you guys to also note is that this is the layout of the paper. The change about this is that they are putting 4 questions onto a page. The one last year had 2 or 3 questions on a page. And there was actually quite a bit of room to actually write your 1-minute structures underneath. So it looks like, by having this set out here, there's actually less room to do your 1-minute structures. And you know how I'm a big proponent in terms of 1-minute structures and how it can really sort of set you up really nicely for this exam here, okay? So just be aware of this, is that the new sort of format is now putting 4 questions on the page. So you might need to sort of change in terms of the way you write, in terms of how big you write, okay? Now, take-home messages in order of importance, and this is always a consistent theme, is that definitely cover all the short answer questions from the last 10 years. So there's over 300 short answer questions. Obviously, some will be repeats, but by doing that, you'll have 70% coverage of the paper. And what I mean by that is that if you go through all the short answer questions, there will be concepts there. Whilst there might be new questions or let's say variation questions, there will be concepts that you will learn from the short answer questions in the last 10 years where you can apply it to those questions there. All right. So definitely from the last 10 years. Now, the question that has always been asked is, after you do the short answer questions from the last 10 years, where do you go and find new questions from? So the last sitting, there was a thought that they were lifting questions off from the ICU paper. And I think that's not happening. So what I would suggest is that once you cover the short answer questions from the last 10 years, think about perhaps looking at short answer questions from over 10 years ago. Okay. that would be a source of new questions. The third thing is think about learning objectives that haven't been asked before as potential new short answer questions. All right. There's obviously a lot of work, and this needs to be done in a in your study group. And if you manage to do all that, the last suggestion would be to review the ICU papers. Okay, there still might be some value in them, but I think looking at how this last paper went, what I would adapt is that I would start looking at short answer questions from the old curriculum, and then also think about learning objectives as short answer questions as well. Now, the final tip is make sure that you've got a copy of the ANZCA Primary Companion by Lockley Rathie.